Good morning, everyone. Welcome on into North Dakota today. As winter continues to unfold and the days can remain dark and cold, it's not uncommon for many of us to feel down or have the winter blues. But if you've noticed a significant change in your mood that impacts how you feel, think, and behave, this could be a sign of something more serious. Dr. Alexandra Coles from Essentia Health is here to share more on the importance of this wintertime possible disorder. Good morning.
Morning.
It's so nice to have you.
Thank you for having me.
Of course, it's cold, it's dark, it's gloomy. Luckily, we're on our way toward a warm-up, but that's not always going to help us. Let's just get into it. Could you explain what seasonal affective disorder means?
Absolutely. It's a specific type of depression that typically affects people based on the changes in seasons.
Okay. And the acronym for it is SAD.
Yes.
Which makes sense in two ways, obviously. Yes. So what are the causes, though? Is it specifically the weather?
Yes, weather, sunlight. We tend to see it affecting people when the days get shorter, less sunlight. Also in cold, rainy climates where people tend to just feel more down when they aren't able to be outside as much and don't have access to the sunshine.
Yeah, and that's something we're all at risk of in our region, huh?
Yes.
So is this a specific age range, or can this happen to anybody?
It can happen to anyone. We typically don't see it as often in children, but certainly anyone's at risk, and people who have family histories of depression may be more prone to any type of depression, including SAD. And again, it tends to be very geographically oriented. You know, the Pacific Northwest, places with really cold, harsh winters, such as the Fargo-Moorhead area, and then places such as Alaska, for example, where they have, you know, long periods of time where there's no sunlight at all.
Yeah, that's a great point. So what are the specific symptoms of SAD?
So they're very similar to other symptoms of depression. Typically, people tend to notice that they lack energy and motivation. They may not enjoy the activities that they typically enjoy. People may feel sad, may notice that they cry a lot more. Social withdrawal, so particularly for people who are very socially motivated, not really wanting to go out and see friends and family. Feelings of hopelessness, and certainly suicidal thoughts as well.
So how is that diagnosed separately from depression, as you had mentioned? If it seems so similar, how do we know that it could be SAD?
Yeah, that's a great question. So I would always recommend talking to a professional to really help to differentiate, but I would say that it looks very similar. It is a specifier of major depressive disorder, but it has a seasonal pattern. So when people report that this is something that is cropping up for them with the change in weather, particularly if it happens year after year, then that's a really good indicator that that's probably the type of depression that it is.
Got it. Okay, so how is this treated? Is it anything separate than other depressions?
I would say that there are additional interventions that people can use. I think that therapy is very helpful, possibly getting on an antidepressant, especially if there's a seasonal component. That may just be something, a medication that people take during those difficult times of year. But then we recommend the use of a happy light. Those are actually very useful, and they sort of simulate sunlight. People tend to discover that they experience an elevation in mood using those lights about even 30 minutes a day.
And so that's like a UV sun type of lamp that you can just have in your home, right? Because I've seen these, I've heard about those.
Yes, without the UV rays. So it's actually.
Oh, right, sorry.
Yes, so it's actually.
Not the cancer, not the skin cancer,
yes,
everybody.
It has all the benefits of sunlight without the detrimental effect.
I've heard of that, especially for people who even work night shift, such as myself. I wake up in the middle of the night, and so I've looked into possibly getting a sunlight lamp to try to just pretend that I see daylight sometimes.
Yes. No, I think that's a wonderful idea.
Wow, okay, that's pretty great to know. How can people find more information?
So I think if people are concerned about any type of depression, I would highly recommend speaking to a primary care provider, talking to them, possibly getting a referral to a behavioral health department. The behavioral health department on South University is a great resource, and I think especially if people have feelings of hopelessness, thoughts of suicidal ideation, getting immediate help for those things. The American Foundation for Suicide Prevention has a great website, afsp.org. And then, of course, any immediate needs, I would always recommend going to the emergency department for an evaluation.
Sure. Thank you so much for coming on this morning.
Yes, thank you.
Yeah, it's prime time. This could really help a lot of people at home, so thanks.
I hope so.
Yeah. All right, stick around, everybody. It is Monday, so up next we have Cooking with Cashway.